Welcome to the conversations. My name is Ismail Akwe, and our conversation today is with Ali Ghanem. He's a doctor, is a plastic surgeon, a consultant aesthetic, is a health coach. Calls himself health priest, and everything you can think of. He's multiple award winning as well. Welcome, Ali Ghanem.
Thank you very much, Ismail.
So we are all on social media. We see a lot of social media posts talking about health and some health routines and everything. Do you think it's advisable to take health expertise tips from social media pages that are trying to get numbers?
Ismail, this is a very good question. And that really has in it three independent variables that we have to understand, before we have a wise answer. So the first thing you are asking is that is it important that we engage with our health to seek some sort of guidance? The second thing is actually what is happening with social media as a source of information. And finally, is the like celebrity or the influencer culture a reliable source of health information in modern days? So these are three very, very important questions that we have to distill and answer. And in essence, I can give you a quick answer. And in fact, DeepSeek or ChatGPT can give a better answer than me. But in my humble opinion, there is nothing more important than health. Because if there is no health, i.e., if my brain is not functioning well, then I don't exist. There is no life. Health is actually life. And as we wrongly thought of health in the past as the state of absence from disease, we should really upgrade our understanding of health to think of it as the optimal way of existence. So it's not actually that we don't have a disease, therefore we are, healthy. Because if I am, for example, absent of disease, but actually I am not able to enjoy my cognitive function to the best, I'm not able to enjoy my muscles and bones in my daily activity to the best, I'm not able to enjoy my like metabolism and the way that I digest my food to the best, then I am missing out big time on life, even though I don't need to see a doctor because I don't have a disease. The second thing is in relation to social media, and I don't need to tell you that social media is extremely important. And unfortunately, for both the good reason and the bad reason. I give you an example. So there is actually evidence from our colleagues in the United States that in aesthetic plastic surgery, the area that I feel comfort zone and I know a lot about, people income in the United States, colleagues who are aesthetic plastic surgeon, is not correlated to their knowledge, is not correlated to their skills, is not related to their expertise or qualification. The only factor that is correlated between like income and aesthetic plastic surgery career is the time spent on social media. So you could see that it is extremely important and a great motivator for like people to just go there, because if people don't see you now, if they don't hear of you in social media, it means you do not exist. Your philosophy is irrelevant. Your knowledge is trivial. And unfortunately, excuse me, unfortunately, as a result, there is actually this argument that somebody who has to attract attention is more able to create trends and influence people's health than the best and the most qualified of healthcare professionals. In my domain, there are certain companies that went bankrupt, actually became so financially successful because like a particular singer or a particular sports personality referenced them in their daily routine or in their aesthetic routine, etc. So however, in relation of seeking advice, health advice from social media, we have a huge ocean of misinformation, of like people who want to jump on the bandwagon in order to notoriety and financial gain, that actually end up giving that bad advice. And you can only like do a very Google search to see the catastrophes and the lawsuits that happened because of harm, fatalities, injuries that is from people following the wrong advice from social.
Thank you very much for that. And there's a natural need for a more healthier life and a longer life. But however, it seems there's the belief that it takes only the rich to go after a longer life. Because when you see the doctor, the things that they're supposed to do, the routines, the things they need to spend on, they are quite for those in the higher income status level. How true is this? Can a poor person seek for a longer life and also have a much healthier life?
Thank you very much. And luckily, we are living in this time now. And I say luckily because we are at a time where we are living the longest that any of our ancestors, if we are to exclude some biblical references, that lived ever. And this is because of public health intervention, availability of clean water, vaccination of children, improved neonatal care, to name a few. However, unfortunately, we continue to face a where the quality of our life towards the end of our existence is not as good as the number of life years lived. So what does that mean? Is that, okay, we are likely, if we are alive now in the 21st century, that we will be statistically alive to the age of 80. However, I wouldn't say that the last 20 years from 60 to 80 will be equally good for the people in this world in a proportionate way. People who do not engage in improving their health early and address the main deteriorating reasons for our health will likely to have a miserable last decade or two. And that's the concept of longevity. That is not that how long we are going to live, but how well and how good we are going to live. And yes, indeed, to live in a healthy life might require some expensive interventions that might be available only for the people who have access to important healthcare facilities and technologies, such as hyperbaric oxygen or a certain diet, etc. And we all became very familiar with this concept because of a celebrity, social media celebrity, Brian Johnson, the gentleman behind the Netflix film Don't Die, because after he managed to sell his tech companies and accumulate some wealth, he really very impressively dedicated a lot of his wealth and focus and time to investigate personally as a normal human being, not a doctor, the concept of longevity. And he claimed to have spent $2 million per year for several years to arrive at that peak performance longevity optimization. So we are talking about a huge amount of money that usually would be enough to look after, a whole city in some parts of the world from healthcare needs that are delivered to a single person in order for this person to optimize their life. I argue that longevity is not the art of living better that is only dedicated to the rich. It is very known around the world that there are blue zones such as Okinawa and South Japan, or Sardinia, or pockets in South America, where people and enjoy a healthy and long life, even in poor village communities, because of factors that would be nice to explore in this interview later. So no, even though technology and wealth can help us utilize a lot of technological advantage to our quality of life, but actually to live longer and healthier does not require for you to be a millionaire to achieve that.
And in current times, people do a lot of routines. They try so many other things to be healthy. What are people getting wrong lately?
So routine is very important, because eventually we are a machine that works in a circadian rhythm. We have day and night, we have spring and summer. We all very familiar with the consequences of jet lag and change of time zone, or like night shift on a human being and disturbed sleep, etc. I mean, like sometimes in war zones, just like putting people without sleep for a couple of days is considered a form of torture. So to have a routine is extremely important for our physical, mental, and emotional well-being. And accordingly, the secret of a long, healthy life comes in developing healthy habits. And for that, of course, if we are to overindulge in routines that are not evidence-based or totally superfluous, it will be waste of time and effort. And equally, if we are engaged in routines that are, like not based on sound evidence and science, then definitely we are creating a problem that we are going to meet in the future. But definitely without a routine and a program and a discipline, it is not possible often to have like a healthier life. I give you an example. If I give you now $1 billion and ask you to make your body fit and healthy, then you will not be able to create that. But if I tell you to do like a simple 100 push-ups every day for 1 month, you will see that all your health metrics after that 1 month will hugely improve in that, when $1 billion could not do anything to bring you to the same healthy outcome that a simple exercise and a routine such as 100 push-up a day will be able to give you.
So are you saying the routines are all good? For instance, waking up early in the morning, taking warm water before you sleep, and doing the push-ups, are they all good?
I think there is a healthy routine that we should assign to, and I would love to explore with you some of my advices. Like I am not a newcomer to this field, and I'm also not a pioneer. This field has been explored for thousands of years. If you go to the working of philosophers in Greece, and also like old China and the Arab world during the time, before Renaissance, you will see lots of volumes about healthy habits and the benefit of having a regular routine such as meditation, or like meal plans, etc., on the health of a human beings. For me, I think discipline and routine has a lot of benefit that is going to kind of be impacting our life. However, these routines should be validated and evidence based for them to be useful.
Okay. Okay. And then lifting weights. I think this is like the new phenomenon where people are trying to lift weights. And there's been some studies that say it's linked to a more effective brain. It protects the brain. How true is this?
It's fascinating. Like for me, I have never been a great fan of weightlifting, and I had some interest in sport when I was little. I was doing football, horse riding, and sometimes I used to run. I ran 3 marathons in my life. So going to the gym and lifting weights was never something that I took seriously, and I actually was somehow put off with some of the obsessed people who are going after their body and injecting steroids and all sorts of that. But actually, as I started taking a very specific interest in longevity and preventative medicine, I understand now that our muscles are our longevity organs, because muscles are not only there to move our limbs. Muscles is the best place to metabolize glucose, for example. So muscle mass is associated with much better insulin tolerance and glucose metabolism, which prevent obesity and prevent, kind of cardiovascular disease. Muscles are our reservoir of mesenchymal stem cells. So as muscles get micro injuries, it mobilizes the stem cell population in the pericytes around the muscle fibers, and they will also have an impact on our, well-being, regeneration, and overall, cellular health. Muscles are also the reason why we have a good posture. Muscles are also needed to be coordinated by the brain, and therefore what the study that you have referred to compared those people who do some mental exercises such as Sudoku or chess versus those who work in the gym. And you can imagine that if you are thinking about a chess, you will consume a lot of calories, and your brain is using a very important part of it. But when you are in a gym working on groups of muscles, pushing yourself to the maximum, trying to pull these extreme weights for your own proportions, for example, all this motivation, fear of failure, like drive, the coordination of the musculoskeletal systems, the bone pain, the muscle pain, all that totally engage the brain during this workout. So it's not a workout only for the lungs and the heart and the muscles. It is a workout of our nervous system, which, according to the law of don't use it and lose it, it will be much more beneficial, as the studies show, compared to just trying to use a bit of the brain to think about a mathematical formula.
Mm. Well, I want you to give us just five simple tips that everyone can follow to have a longer, healthier life.
Well, I will tell you six. I
Mm.
prefer to kind of like give you my system. So thinking about longevity and the main killers of Homo sapiens beyond war and injury, which are, the heart attack, cancer, diabetes, and metabolic disorder, as well as a neurodegenerative disease. These are the main four killers of humanity. So I wanted to create a system in which I can practice and I can teach with low cost to democratize longevity. And I used my surname, Ganem, in order to simplify it, where G is for gut health and nutrition, H for heart and lung, A is for aesthetics and skin health, N for neoplasm or cancer prevention, E for endocrine and hormonal health, and finally M for mind and emotional well-being and health. So accordingly, in order to have a very effective life, we have to look after these six domains in our day-to-day existence. And accordingly, I will give you a tip per system. So in our practice of longevity medicine, we appraise each one of these six axes, and we have a very comprehensive investigation and assessment to each of them towards total optimization. However, as a do-it-yourself Ganem protocol at home, I will give you these six steps. So for G, for the gut, you must count at least 5 different plants in your daily food. So try to play with yourself this game and count at least 5 different plants. We all know from the government, 5 a day campaign for health. And that's very important for reasons that many people don't know about. So for example, we have much more number of alien cells in our body than our own cells. These are the microbiota that lives in our gastrointestinal system. And this microbiota hugely dictate our health and well-being. And if they are not healthy, we are not healthy. So we can, from a simple stool sample, predict people's health and also their age with a marginal error of 3 to 5 years only. So the microbiota is extremely important, and we can feed it and make it healthy along with, you know, the good health and the metabolism and the nutritious advantage of plant-based, you know, diet, but count 5 different plants per day. For H, for heart and lung, I highly recommend that we try to walk 30 minutes in a brisk walk per day. So that is approximately 5 to 10,000 steps, depending on where you are, and it has to be brisk so that we raise our heart rate to zone 2, which is the busting of the fat zone and also the cardiovascular compliance zone. So if you are like me, for example, I work around 5 kilometers from my home. I try to make sure that either my way to home or back from work are done in this brisk walking. And that's like around 35 to 40 minutes, which is just perfect. If you like, you know, commute to work, try to stop the car at a place where you can make the continuation of the journey on foot, and so on and so forth. Aesthetics, I highly recommend that you use at least factor 30 sun protection on sunny days. Even though on cloudy days, ultraviolet B rays can come and damage your skin, it's very important that you try and develop a healthy habit of using sunscreen, because it's evidence-based to prevent skin cancer and also protect your appearance and the radiance and the health of the skin for a long time. In relation of the N, the neoplasm and cancer prevention, try to make one of the 5 vegetables that are referred to, or fruits that are referred to in the plants in the first advice, as a cabbage or its sisters, such as kale or cauliflower or broccoli, etc. These are fiber-rich diet that is being associated with significant reduction in the risk of, you know, cancer, not only the gut but also different parts of the body. In relation of E, for endocrine and hormonal health, I highly recommend you keep a log of the quality of your sleep and try to sleep between 7 to 8 hours every day. Sleep is the most important regulator of our stress hormone, the cortisol, and the most important resetter of our endocrine system. And without it, our life will be really stressful and be impactful to not only our hormonal system, but our also mind and metabolic and, you know, the rest of our body. Finally, in relation of mind and emotional well-being, I highly recommend that we all try to understand meditation and practice meditation every day for at least 10 minutes. Meditation is like going to the gym. You might go for a week or 2 and you will feel sore and distracted and unhappy, but only by continuously to do it, you will see the advantage of it. So going to the gym for a week or 2 will have 0 results on our life, but going to the gym for 100 times, you will see an amazing transformation in the body and health. In a similar way, trying to practice meditation for a short period, even though you will not see the advantage of it in a few days or a few weeks, but believe me, if you put that into your practice and routine and try to understand and do it very well, there are different types of meditation. Any of them would be good. Simply 10 minutes per day, and you will then thank me when you are a master meditator. So these are my 6 tips for longevity at home.
These are great tips. And finally, I want to know, with these tips, which one or what would you call extreme? What would be
In
extreme? Hmm.
extreme, there is no extreme in these tips. All of them are amenable to our daily routine. But if I am to prioritize one, it would definitely be the 30 minutes brisk walk every day. You know, so this is the priority number 1. You know, muscle building and heart training and lungs, you know, training is hugely important for everything, for the gut, for the heart, for our appearance, for our mind health, for our hormone, and therefore that will be my pick for just one out of the 6 steps.
Thank you very much, Professor Dr. Ali Ghanem. I know you don't want all the titles. This is Conversations, and hope to get to you, and then we'll have another conversation another time.
Thank you so much, Ismail. I very much enjoyed this conversation, and I am available always. I think it's very important for us all to engage in public health, and it's a great pleasure for me to speak to your audience today.
Thank you.